Hi everyone, today we're studying about Ansa Cervicalis. So this is basically a loop of cervical nerves, especially C1 to C3, located in the anterior triangle of the neck, formed by superior and inferior roots supplying the infrahyoid muscles. So what is this? This is a loop of the cervical nerves. So this is your entire cervical plexus. You can see C1, C2, C3, C4 and C5, right? So C1, 2, and 3, they form a loop. So see, what is it again? C1, C2, and C3. They form a loop. This loop is basically known as an ansa cervicalis. It has a superior root and it has an inferior root. So inferior root is formed by C2 and C3, and the superior root is formed by C1, right? And it gives innervations to three muscles, which are sternothyroid, sternohyoid, and omohyoid. I know you can already tell that these are infrahyoid muscles. So except the thyrohyoid muscle, it's giving innervation to all of the remaining muscles. So these are the let me show you what are the muscles right here. So these are the infrahyoid muscles. These are sternothyroid, sternohyoid, and omohyoid. It gives innervation to sternothyroid and then sternohyoid. So sternothyroid, sternohyoid, and omohyoid, but not to the thyrohyoid, right? So this is its innervation. Now, yeah. So now this is situated in the interior triangle. What is its location? That's one thing you need to know. It's located in the interior triangle of the neck. It lies embedded in the interior wall of the carotid sheath. So where exactly in the carotid sheath? So do you remember the carotid triangle? It had the carotid sheath. So in the carotid sheath, it lies in the interior wall. So if you look at this, this is the carotid sheath. This is the carotid sheath. Carotid sheath has carotid artery. Some people say it's internal carotid artery. Well, okay, even the book says it's internal carotid artery. Then you have internal jugular veins. Internal jugular vein is laterally. Carotid artery, which is the carotid artery, it is medially, and then in right in the middle is vagus nerve going vertically downwards. So that's the vagus nerve, right? So this is your carotid sheath. Now, carotid sheath, it is basically this is deep cervical fascia, right? One of its layers is carotid sheath. So when you talk about its outermost layer, in that you'll notice there's ansa cervicalis in the interior area, right, within the wall. So vascular compartment contains internal jugular, carotid artery, and vagus nerve, and ansa cervicalis is within its wall. So this is the loop. So you can see the superior loop and the inferior loop. So when you talk about this one right here, so it's here. I hope that makes sense. Now, talking about its location, interior triangle of the neck, carotid sheath, it's usually superficial to the internal jugular vein. It's deep to the sternocleidomastoid. So it's deep to the sternocleidomastoid. Now, it is formed by two roots, superior root and inferior root. Superior roots fibers are taken from C1 spinal nerve. It briefly travels with the hypoglossal nerve, descends on the carotid sheath. Inferior root fibers these are formed by fibers from C2 and C3 spinal nerves. It descends separately in the neck. The two roots join to form a loop ansa anterior to the carotid sheath. It supplies the infrahyoid strap muscles except the thyrohyoid. So sternohyoid, sternothyroid, omohyoid. So thyroid is supplied by C1 fibers via hypoglossal nerve, not by ansa cervicalis. So this is about it. So I hope you can see here as well. This is ansa cervicalis. Superior root and inferior root, right? So superior and inferior.